So just don't do anything crazy. I'm also going to mute everybody. So you have all been muted. If you would like to speak, you'll have to unmute yourself. We don't have anybody on the phone, but I'll say it anyway. If you're calling on the phone, you'll have to press *6 to unmute yourself. We don't have a guest speaker tonight, but I do have a lot of updates for you as always. So Rep Morgan, do you want to introduce or welcome everybody before I get to the updates? Oh, you're muted. I muted you. Sorry.
Thank you guys for coming out tonight. We always look forward to this opportunity to talk with you guys, and obviously, we've been through a lot in the last month, and we got another month. I don't know if you guys have heard, if everyone has heard, but I am in a runoff with Joe Molinar, and but I feel very good going into this thing. 8,000 people voted for me, which is crazy. Just so you guys know, we've never had the voter turnout the way what we had the other day. Just so you guys know, in the Northeast alone, in the Northeast race alone, over 22,000 people voted. That's crazy. 22,000. In the two previous elections that I've been in, we were lucky to get 5,000 total. Tracking with me? You can usually win these races with like 2,500 votes. Okay, but I'm proud, and I want to thank you all for your support, whether you supported me or not. For getting out there and doing your civic duty, because I'm telling you, this next go around, what is it, Lindsay? The 12th of December?
Yeah, so that's what the media is saying. We haven't heard anything from the elections department, but they're saying the runoff election will be December 12th.
Okay, just so you guys know, mark your calendar, back up a week or so, early voting will start. But once we get the exact dates, we'll let you guys know because obviously you're not going to see the turnout that you saw this last go around. So every vote is going to count because a lot of people came out. We had almost over 4,000 people who went in and undervoted, which means they went in, they voted for a president, but they didn't vote for a city rep whatsoever. Just the people who undervoted were enough to tip the balance into anyone's favor. So keep that in mind. That's how important voting is. And as you can see, we're still counting the presidential elections, and that thing is probably going to go on for another week. So welcome. Go ahead, Lance.
Yeah, absolutely. I know that. Oh, someone took over the screen. I don't know who that is, but if you could not take the screen over, that'd be great. Okay, so I'll still continue with my announcements. So obviously you guys know I've always given updates on COVID. So they had a press conference today. It wasn't really anything new. It was kind of just, our numbers are still really high. We're trying to see, it's sad and it's unfortunate. They did talk about yesterday, I don't know if you guys noticed, we had a spike. It was like 3,000 positive cases. They did say that was a delay in results. And so that wasn't necessarily accurate for the, 24-hour cycle of positive tests, but it still is a lot. Today we had over 1,000. So, we're still in a really bad situation. Basically, if you think you've been exposed or if you are having symptoms, please go get tested. It's free. There's testing locations almost everywhere you look. So there's some that have appointments, some you can drive up to. So epstrong.org, you can find whatever you need for that. And then, of course, just stay home. The mayor mentioned that the top two places where the cases are coming from and this, of course, is information we get via contact tracing, what people are telling us that they're doing. The first place is big box chain stores like Walmart, Target, Albertsons, stuff like that. And that doesn't necessarily mean they got COVID there. Those are just places that they had been in the time frame where they got COVID, if that makes sense. So if you have to go shopping, just one person from the family. And then the second place that people are getting COVID is home gatherings. The issue with that is that we noticed, so if you guys recall, the mayor put out an executive order about bars closing, or restaurants rather, because bars are closed, but restaurants closing at 9 p.m. They have to go to takeout and delivery only. And that was to kind of curb bars that converted to restaurants being able to operate until 2 in the morning. But what we noticed happened is the bar closes at 9, so people leave there and then they go finish the party at someone's house. And so it didn't really fix the problem. People are still getting together. So just if they don't live in your household, you shouldn't be hanging out with them unless it's virtual like we're doing now. So just try to keep that in mind. I know I'm like a broken record with it, but it's not going to go away anytime soon if we keep going and hanging out with people that don't live in our house. So go and get your groceries, your prescriptions, go home, and that's how we're going to get through this, unfortunately. I know there's been a lot of confusion with the judge's order versus the city order versus the attorney or Texas Attorney General saying the county order doesn't stand. So it's been very confusing, and they're actually in court. I think, were they supposed to have a verdict today? I think that's what he said. Yeah, but we haven't heard anything, so we'll let you guys know. But for now, El Paso PD has said they're not going to enforce the county order. So if you're a small business, you can stay open. You know, you won't be shut down until that court hearing's over and we see what happens with that. But that doesn't mean go out and have a party, stay home, do whatever you need to do, and that's it. So that's basically my COVID update. Nothing too exciting. It's the same old, same old. I know I'm a broken record, but I'm not going to stop talking about it. My next update, obviously you guys know this already because I tell you all the time, is El Pasoans Fighting Hunger is still serving our community. We have a location that's very close to Northeast now at Nolan Richardson. So if you know anybody that needs food, that's our Northeast location. Please spread the word. Yeah. My next update is about flu shots. We had some questions. Where can I get my flu shot? The city is still holding free flu shot clinics all over the city. And they actually just announced one that will happen in Northeast at Veterans Park. It's going to be a one-day event, and it will be a drive-through event. So it'll be November 14th from 9 a.m. to 3 p.m. And the flu shots are free for anybody over the age of 6 months. So take advantage of that. November 14th, Veterans Park, 9 a.m. to 3 p.m., free flu shot. You can take the whole family that lives in your house and get your free flu shot. So
hey guys, and that drive-through flu shot stuff actually happens very fast. So, you know, if it's a lot faster than COVID testing, obviously. Okay, so take advantage of it.
Yeah, absolutely.
Lindsay, is that a Saturday, November 14th?
Let me double check. I didn't look up the actual date. I just read.
I'll put that on Nextdoor and Town Square.
I'm sorry?
I'll put that on the Nextdoor app.
Oh, okay, perfect.
Okay, so it's November 14th?
It's a Saturday. And if you go to the City of El Paso's Facebook page or our Facebook page, we shared it. There's a graphic because there's more locations like every day. It's a different location. So if you know anybody that's not in Northeast that needs a flu shot, there's different locations citywide.
Okay, so put the Facebook page.
Yes, there's a graphic in there that has all the information. You can steal it.
Thanks.
Of course. I was just gonna say, yeah, it is a really quick process. I know I got my flu shot through a drive-through one. Angela and her kids got them, so I was only there like maybe 15 minutes, if that. And that was filling out all the paperwork, driving through, and then the shot's very efficient. They're like, hey, what's up? Here's your shot, and then you leave. So very efficient, very quick, doesn't take too much time. So please take advantage. That is all of the updates I have. I don't know if Rep. Morgan wants to say anything else, but we'll open it up for questions or whatever you all want to talk about.
Yeah. Hey guys, we weren't sure exactly how this meeting was gonna work today because I know everyone's still waiting for the outcome to the presidential elections. I've been glued to the TV myself pretty much all day, but right now is an opportunity to just have some open dialogue. What's on your minds? What are you guys worried about? What's going on out there in the Northeast right now? I know Myself, I've been very obviously distracted for the last few weeks, but just want you guys to know that we're still here. We're still putting in the work. Lindsay and Angela are doing a great job of holding down the fort, and we're still open for business. Okay, so what's on your mind?
Okay, I have a question. If a traffic light is completely taken down on like Gateway South or Gateway North, is that TxDOT's responsibility?
It is, but we can report it for you.
Okay, because it looks like a huge accident has taken one down. So it's between the Sean Haggerty intersection and where you, before Planet Fitness on the right-hand side on Gateway South. Like
Okay.
you're going to Marshall's and Chick-fil-A and all of that. It is completely disintegrated. And they don't work at night.
It's a traffic light or a street light?
A street light.
Okay, got it. I was like, traffic light.
No. And then, Sam,
That
do you know about the big TxDOT thing going on right now on 54 right here at McCombs? Have y'all been updated? It's down to one lane. And they have, like, say you're going to Mesquite Hills, they have you in one lane, and they have everything else orange coned off, barricaded off, and it says right lanes closed. So I can't make a right onto McCombs. I kind of have to zoom in the cones. And so they've closed the two right lanes. So the middle lane and the right lane, like you're going to Mesquite Hills, is closed right now. And all of that traffic is feeding into the left lane as of like 10 minutes ago when I got home. And so I'm not sure what TxDOT is doing, but that just happened in like the last 2 days.
Okay.
So traffic is like crazy.
Yeah, we can look at that because I'm not tracking on anything that should be happening out there right now.
Oh yeah, they've got cones. You have to move over from the right lane as soon as you go through the Gateway North Sean Haggerty light. You have to start moving over.
So it was there this afternoon as well. It wasn't there when I was on my way to El Paso before Austin's doctor's appointment. So when I was on my way back, yeah, they were closed off and the left lane was closed. What I think it's associated with is them working on 54. They're completely repaving, I believe, 54 from Gateway South all the way down to
State
the
line.
edge of Texas.
Okay.
Yeah.
That may be it, but it is crazy.
I'm thinking, but that's what I went through State Line the other night, and yeah, it was pretty bad.
Yeah. It's like, what just happened? Where did all these orange cones come from? And what's going on? That's what I figured, but you have so much traffic going to Mesquite Hills and farther out. So everybody's in a hurry to get over and cut each other off because you literally at McCombs cannot go straight except for the left lane.
Got it. Okay.
Yeah.
Yeah.
So
I'm sure
there could be, some traffic. I heard some honking today, people honking at each other. I'm like, just let each other in, I did hear from Tammy regarding Vino. Vino will not be able to make it to anything, it looks like. He was severely traumatized in the accident and has become very aggressive dog and is living his retirement life in the Border Patrol kennels. He can't even go home. Wow. So it breaks my heart. It broke Tammy's heart. She was very upset. So that's what we know right now. He just, in that accident, just was not the same dog afterwards.
Yeah, I can imagine that,
Yeah. So.
Well, thanks for that update.
But she sent a really nice Facebook thanking everybody and for the update on the dog park that's going to take place, hopefully, stuff starting to move now. So she is abreast of that and is very excited about that. But she had looked into finding Bino and she heard from the canine coordinator that he's just not, he's not the same and he's just too aggressive for anything, which breaks my heart.
Yeah. They're also we are trying to get though, the Border Patrol actually named a canine after Joey. The dog's
Oh,
name is.
good.
And so we're actually trying to, but he's stationed in Del Rio. And so we're trying to coordinate to see if that dog can be down here for the opening or for the groundbreaking.
Groundbreaking. Yeah. And will y'all let me know too so I can just walk down the street?
Yeah, we'll put it out there once that happens.
So she's really missing her son right now. So she comes to the park a lot now.
Yeah, that's good. Oh, Sam, you're muted.
And I speak on her behalf because, I love her so much.
This around the time that he passed?
He passed in April, but it's holidays and she's, we talk almost every other day. So being a teacher, she's staying extremely, extremely busy.
Right.
But she's ready to see this take place and, go forward. And she thanked you, Sam, and County Commissioner Robinson. And Lindsay, you were mentioned in the Facebook as well.
Yeah, I was tagged in it.
Yeah. So it was really heartfelt.
Yeah.
Thank you for that. I appreciate that.
Yeah.
For those of you that are on and don't know what we're talking about, let me give you a little bit of background.
Oh, sorry, guys.
You know what you're talking about. So we're talking about Joey Barraza and Vino Memorial Park, which is located on McCombs, where it used to be Northeast Regional Park, but Brett Morgan was able to get that renamed through council. And so what's happening is that phase 1 is already complete, but phase 2 of the park includes a dog park and some flat fields and some other things. But because it's going to be the only dog park in Northeast, it's very fitting that it's named after Joey Barraza and Vino. So Joey Barraza, was killed in the line of duty. He was a Border Patrol agent, and he had a canine whose name was Vino. And that's who Kim's been talking about, the dog that won't be able to make it to the groundbreaking. But just so if anybody was wondering what we were talking about, that's kind of a very quick synopsis of the whole situation. But that project is out for bid for construction right now. So council should be voting on that contract. I'm going to assume December, January timeframe. And then once that contractor is picked, the project will be under construction.
Yeah. And just so you all know, the park has been out for bid before. So they've had to redo the numbers and the request so the numbers actually are accurate. So folks can bid a decent amount of money. Okay. So that's what's been taking so long with that, and COVID, of course.
And then also I want to mention, it's kind of a good thing. We were all disappointed when it got delayed, but because it is a quality of life bond project from 2012, and it was supposed to be completed in summer of 2019, but it got delayed because of some of the bidding issues. But the good thing about that is that because of that, we were able to take advantage of some Texas Parks and Wildlife grant funding. And so now $2 million is going to be coming from a grant. So it's not going to be coming out of the quality of life bond. So that's really good news for everybody, every taxpayer here, which I know all of us are.
And Lindsay, that's going to go also for the children's area, right? The all access, all abilities children area.
Yes. So 1 million is for the dog park and 1 million is for so I kind of mentioned it, I touched on it. Phase 2 is a lot of different things, but the biggest part of it is the dog park. It also is going to have 2 flat fields, and then an all abilities play area. And what that means is it's a playground that's wheelchair accessible.
Yeah. So I've been telling my neighbors that face that back across the street from me that they will, maybe in the next 2 months start seeing some zoning, flags and stuff like that for the play area, but that the championship fields that go farther out and the lighting and of course, the walking trails and stuff like that will have to wait because it, like Tommy had said in his previous presentation, instead of raising our taxes, he was trying to save the city money, and electricity and watering fields is very costly.
Right. Absolutely. Mm-hmm.
So.
Okay.
Is there any
after Sam retires after council, I'm going to come run for council.
Bring it on.
All right. Were there any other questions from any of the other members that are on tonight, or any comments? Concerns?
Yes. This is Keith Brown.
Hey,
Brown.
Keith.
Hey, how's it going, Sam?
Hey, doing good.
Everyone. I have a question on the health department. How's this contact tracing going? I'm going to tell you what happened to me. I'm locked up in my cave. I don't come out of my cave other than to get food. And I get a text message one morning saying, hey, I've been exposed to COVID, so I've been around you very shortly, for a very short period of time. So I go spin up, go get tested. And I called up these numbers to the health department just to find out, how do you do this? How is this contact tracing thing? Nobody answered these numbers. So if I run into that, it begs the question, how in depth is the contact tracing going on with the health department?
The contact, well, let me go ahead and see if I can take a stab at that. The contact tracing is obviously, just like you said, I thought you should have received a phone call, not a text message, first of all.
No. I got it from here's what happened. And this is all in these families, okay? This is where the infections are coming. It's coming from the families. It's not coming, Lindsay, I would reverse it and say it's coming from the families and then maybe Walmart or something like that.
Yeah.
It's coming from the families. I was shocked when I got the text message from a friend. The 89-year-old grandmother died from COVID. Inside the house, the 40-year-old granddaughter was infected. The 4-year-old, I believe, was infected. And there's some other people within that group. There's about 3 or 4 other ones that were in contact. I don't know the extent of it, but it came to me because the individual's part of that family and had visited that family. But for me, here it is. I'm holed up here, and it's just very brief contact. And I'm like, man, it could have happened. I could have. I came back negative, first of all.
Good. But
what's going on? How is this contact tracing going on? Because if the grandmother died, I would tend to think that they do. I would hope that the contact tracing is aggressive enough to say, hey, who are all the people you're talking to, and you branch out and you do that branching out. Because if they were doing that, then someone should have called me.
Yes.
And it never happened.
So the way that it works, you only are spoken to if you test positive. So it's not for everybody. So the contact tracing is only if you test positive. So that's probably why they didn't reach out to you. And if you test positive, the health department will call you. And if you don't answer, then they'll give you a number to call back, but it's different than the general health department number. So let's say you tested positive. As soon as they'll give you your results, and then they'll let you know within the next 2 days, you should hear from a contact tracer. That person will call you, and then it takes a while because they are, like you said, it's going to be very in-depth, and they're going to ask you where you've been, where you think you got exposed, and then, prior to you thinking you got exposed, where have you been? Have you been anywhere in a home gathering, a party? How many times have you gone to Walmart? It's very, very extensive, and that's where the data is coming from, showing that our biggest, so it's not necessarily saying the cases are coming from Walmart or big box stores. It's more saying the people that have tested positive have been to those locations within the time frame it takes to get infected for them to be positive today.
Okay.
Does that make sense? So
14-day incubation period.
Right. So that contact tracing, they go back and ask you, where have you been basically in the last 2 weeks? And it's, I think it's hard. It's challenging because some people, especially if people are still working and driving to work every day, and then, I stopped at Walmart on Tuesday and got, whatever. And then I stopped at Starbucks the next morning on my way to work. So it's kind of hard for people to remember what they've done for the last 2 weeks. And I think that's where some of the contact tracing is falling behind, but it's no fault of anybody because, I don't think any normal person keeps tabs on what they did every day.
Well, here's what I'm on the outside looking in. The contact tracing in the families is the problem. Okay. That's a big problem. Because here's what happened. Grandma dies, right? She's dead. I'm going to tell you, she's dead because, I went there and saw, looked at the cemetery. Yep, she's dead. All right. Okay. So grandma's the source. Next is granddaughter. Okay. So that's secondary infection or exposure. After that comes the next, the granddaughters, the mother. So that's a tertiary infection, and then it's me, possibly, possible exposure.
Mm-hmm.
Contact tracing should come back to me. There should be a loop. The way it should work is some kind of loop, so that there's some kind of notification somehow that, hey, you may have been exposed, but they haven't even contacted the mother. Okay, so you have grandma, you have the granddaughter. They didn't contact the mother, who actually has been exposed. She's been exposed to her daughter, of course. Mm-hmm. And there's something not right with that. There is just, and then he quick.
I'm gonna have to agree with you, but the only way that they would have been able to contact you is if in that loop, those folks said that they had been in contact with you. That's the only way that health officials would know that you have potential exposure.
There you go. Okay, I'm glad you brought that up, Sam. Why? I'm going to go to lesson number 2.
Okay.
I called up the individual, the daughter, the 40-year-old, no answer. And then so I sent text messages and I said, hey, what's going on? What's going on? Zero response. So I get back this answer saying, well, she's kind of not talking to anybody. So here's the thing. You've got these families doing their family thing, and it's out of control. But here's the bottom line. This is what I guess I want to get to. Mayor Margo may say he doesn't want to be enforced, he doesn't want to enforce things, he doesn't want to crack the whip. But I'll tell you what, this is not going to go away if there is not if feet are not held to the fire. If there's not some legal remedy to force people to report who they are, who they've been around, and so forth. It has to be done. Otherwise, we'll never get out of this until a vaccine comes about. And the families are the problem. And then there's at least, and I could imagine in this case, individuals laughing at this, like, you know what, I'm 30 years old. If, I run 10 miles a day, that kind of nonsense, you know? And so there has to be some type of enforcement. Otherwise, it's never going to stop. It's never going to stop. Because think about me. I'm like, wow, how the heck did it happen to me, of all people?
Exactly.
So it's we're not going to get out of this mess, this pandemic, if there's not an enforcement mechanism that holds people feet to the fire.
Make sure that you pay this week. Next week, we have quite a few issues or agenda items that are discussing exactly what you're talking about. And I would love to have you dial in and give some background as to what you just shared with us, because
that's on Tuesday or
that's going to be, it's Monday or Tuesday, Lindsay.
I need to look at the agenda because there's COVID items on both days.
Okay. So, but it should be Monday, if I'm not mistaken.
Okay.
But we'll let you know.
Mm-hmm. Okay.
Yeah.
If I can get in here about that, there is a thing on people's phones now, and I keep looking at it to see if this area has gone ahead and done it. I don't know if you can see here on my screen. You can opt in or out of it. If you can get it going in the area, the health authority has to do it. And what it does is if you've been in contact or around somebody for longer than 15 minutes, it marks that spot. And it looks at all of the people around you with that phone. So it can alert you on the phone if that person gets a positive test at some point. And it'll tell you, hey, 9 days ago, you were around somebody for more than 15 minutes that tested positive. So you need to go get tested.
Is that an app?
No, they Apple.
That's on iPhone?
Yes, it's an iPhone. They put it on your phone. It came in an update. And you can go in and you can turn it on or you can turn it off.
It's kind of like the
I'm-
emergency alerts, right? Is it in that section?
It is actually just in the general screen. When I open it up in the settings, if it's scroll down, you'll see it, and it says it's a exposure notifications right there.
Oh.
Nice.
Okay.
That's cool.
So I guess I have to get that iPhone 12 now. Now that's my rationale for spending $1,500.
You just need the update. Get the $1,500 yet.
Yeah, just okay.
Thank you, Keith. I appreciate that, and we'll get some information back to you about the updates that are coming out. Actually, they should have been posted today.
Okay.
Yeah.
I'll definitely dial in on Monday at 3:30. Yeah.
Okay.
Yes, sir.
Thank
Yeah,
you.
the agenda just came out at like 5:07 p.m. So I haven't even looked at it. Sorry, but so yeah. I was gonna say, just so you all know, the largest age group that's testing positive is the 23 to 34 age range. Age range. That sounds weird. Age range. So yeah, so that's the biggest group that's testing positive, and I think that's attributed to what I mentioned earlier about going to bars and then the party's not over. Let's go hang out at so and so's house. So
Yeah, it's pretty bad. But remember, like Lindsay said earlier, there is a delay in some of the notifications, the numbers. So that big number of 3,000 the other day, that wasn't a normal cycle. Okay. So, but how many did we have today?
1,022 or something like that.
So the number is already, north of 1,000, and it's not going to go it's not going to go down. It's like what you were saying, Keith. It's like folks have to take some personal responsibility, because this pandemic is real. I lost my cousin. She died a month after her 50th birthday to COVID.
Wow. Sorry to hear that.
And that's my blood relative, and it was a strange thing to know that this COVID that we've been fighting and trying to get people to understand that it's so real, is actually starting to reach into my own personal world and start, it's taking out my family members, and I think it's crazy,
Yeah.
all the way in Texas. So just stay safe, folks. Okay. Hey, Yoli, welcome to the party.
Oh, she's muted. I don't know.
All right.
There we
What
go.
else you got, Linz?
I think Yoli was gonna say something. I don't know. She has her hand up. No, you won't. Okay, never mind. I think that's it. Unless anybody else has any other questions, comments, concerns, feedback.
Hey, I do. Hey, my name is Marcus. I've been joining the calls, and so
Sure.
of course I love the information that's put out in these meetings. It's just really, I feel really informed, especially as a resident of Northeast and everything too, though. So I just want to thank you guys for all the information. I feel like I know what's going on, versus you hear stuff, and whether it's on social media, and sometimes it's right, sometimes it's far left, far whatever. But
Oh, yeah.
I appreciate I appreciate the updates, and it just makes me feel like a better citizen for Northeast, because I'm informed though. So thank you guys so much for that.
Oh, thank you, Marcus. Appreciate you, brother.
No problem at all. No problem at all.
Thank you for
So-
joining us. I wish more people would.
I will definitely spread the word. So definitely.
Awesome.
My wife got me into this. She's like, hey, you ought to listen one day. And most of the time I'm either like out and about somewhere or something else. So I was like, you know what? I'm gonna speak this time. So there it is. So, but thank you. I've enjoyed it. And I've caught, I think I missed last week though, but I've been trying to catch as many as possible. But thank you for the information as well.
Okay.
It's nice to informally meet you.
Yes.
I know who he
Thank
is.
Yeah, I know. Yeah.
Hey, guys, we're working on getting you a guest speaker for the next meeting. I'm not sure where we're at in that process, but there will be a guest speaker. You guys will love it.
All right, sorry, I'm getting text message from Nancy, who's on the call, so I was just reading it to see what question she had. Oh, if you were, I can't remember if it was last week or the week before. I think it was the week before last. We were talking about the place being built on Kenworthy and Trans Mountain. It's something called the Shack. Somebody had mentioned something about a Hobby Lobby last time, but I looked into it. That's not happening. Sorry for anybody whose hopes were high. The other stuff is stuff I'll take care of. She's talking about 311 reports. Angela, remind me, and we'll talk about that. And she asked, why aren't the big box stores closed? So that's because we can't close, per the governor, we cannot close any stores. The only thing we can close are bars. So, and also we can't, if you think about it, we can't survive if Walmart's not open. We have to eat. We have to get our food from somewhere. So that's why the box stores aren't closed. But I will say today in the press conference, the mayor did mention that he has reached out to all of the corporate people at Walmart, Target, Costco, Sam's, etc., and asked them that because our community is seeing a big spike, if they would consider doing capacity limits and implementing some other things just to kind of go back to how we were back in March and April to kind of help spread the, because I don't know if you all noticed, but there was a big difference, in March, if you went to Walmart, it was like going through TSA, like you had to get in line, you had to it was crazy. And but then at a certain point, it just all went away and it went back to normal, aside from wearing masks. So he's kind of asking if we can go back to that TSA level of Walmart shopping, if you will. And I think that'll be a good thing. It'll help it because at the end of the day, we can't close the grocery stores.
Yeah. Remember, folks, it's the governor's orders, and that's what we're fighting with. The county is fighting with right now. As a matter of fact, I believe the lawsuit, the hearing was started today, but the governor is the only person who has the capacity to actually shut these places down. And that's why we're having this conflict between enforcement. I agree with Keith that we do need to enforce because people aren't taking personal responsibility, or they are of the belief that it's never going to happen to them. But until the governor actually shutdowns, I applaud the county judge for taking action, trying to take some action to get the governor to listen as to what's actually happening in our community. But he overstepped his bounds, and that's why you don't see PD enforcing anything right now. Now that doesn't mean that they won't come out if someone calls and reports that you're doing something, or a business is doing something that they shouldn't be doing, or they're over capacity, or they're operating a bar. They'll actually come out, but they're not actively. My understanding is they're not actively out there patrolling, trying to identify people or groups or organizations that are doing this. The sheriff has to stay pretty much outside the city limits. They're out there in the county. Even though the sheriff said that he would enforce, they're not pulling people in from, okay? It's one thing to say you're going to do something. It's another thing to actually do it. So they're not pulling people in from the county coming into the city to enforce these rules. And the reason, like I said, it might appear that there might not be any action going on based off the judge's order, is because it's unlawful.
Yeah.
Okay?
And sorry. I just want to make it clear before you go on. When I said earlier about PD isn't enforcing, I meant they're not enforcing the judge's order. They are enforcing the city order. Exactly. So the judge's order says that restaurants and salons and stuff can't be open. They're not enforcing that. What they are enforcing is that those that are staying open need to follow capacity limits. And so you can still report to PD, hey, I saw 1 million people at this restaurant, and PD will respond to that. So I just want to make it clear they're not just not doing anything.
Correct. Yeah. Exactly. What the order that was in place prior to the Judge Samaniego putting out his order is still in effect. Capacity limits, time limits, all of that is still in effect. That's what's being enforced by El Paso PD. Okay.
I just wanted to comment. I don't know if anyone commented already since I arrived late. The Marshalls in Northeast is closed, and I applaud them for that. So when they reopen, I think we should support them.
Got it. So you're saying the Marshalls there at Martin Luther King?
Mm-hmm.
Okay.
They have a big sign and they're closed.
Huh. Because they had closed down the last time too. It might be voluntary, but I can check that out. I've been kind of catching up on my sleep the last few days.
And
Yeah.
in my opinion, they could shut down all the Walmarts, okay? They've had to shut down 2 of them recently, spur of the moment, and just immediately to start cleaning them. So in my opinion, they should shut down all the Walmarts and give our local businesses a chance to sell some stuff. That's my opinion. When you have to shut down 2 stores of a chain, there's a problem. So but nobody dares to talk back to Walmart. But when you have to do that, there's a problem at Walmart. So I don't think it should be a polite question. Would you please go back to TSA conditions? I think you demand that they go back to it so that they won't have any more shutdowns like they've had of their stores. There's a problem. They're not advertising it. The reporters, I don't know, I guess they're not looking into it. Nobody has really reported what the real problem was at these Walmarts that they shut down. So I think that it shouldn't be a polite answer. It should be a request.
Okay.
No, absolutely. And those were, let me clarify. I kind of misspoke. The mayor reached out and asked them to do that, and that's why Walmart's been closing their stores. So they're making their way around the city and closing them all for 2 days. In their staggered closing to do mass cleanings. It's not because something has happened at those particular Walmarts. It's just they started in Northeast. They just did the one by my house in Socorro, and they're just making their way around all of them. So
do we know that for sure? That there's no incidents?
That's what we were told. We got an email from, so unfortunately, but fortunately, ever since the August 3rd shooting, we have really good contacts at Walmart. And they send us emails like once a month on like updates of different things going on. And in our last update, they did mention it was just a precautionary measure that they're taking to keep their associates safe. But it also helps.
Well, it came from Walmart. It didn't come from the health department as a result of their inspection or anything. It came from Walmart themselves giving out a PR as to what they're doing, which that's good. You know, that's great. But I would sure like to see third party verified.
Okay.
Well, I'm glad they're doing it. We
can definitely check into it. But like I said, the meeting, and I'm not sure if you were on at this time, but there's going to be a lot of discussion about, 1, the judge's order, 2, any updates for contact tracing and reallocation of monies. So that's something that I can bring up on Tuesday as well, because I'm with you. I'd like to know from a independent third party what is going on. It's great that people self-report, but we all know that people tend to self-report what they want to. So good point, Yoli. Thank you.
And that also brings me, I was going to say this back to Keith earlier. I meant to say the issue with contact tracing too is that people aren't honest.
Right.
So
yeah.
People, they ask and they're embarrassed that they went to a Halloween party. And so they're like, oh no, the only place I've been is Wendy's to get dinner. That's the only place I've been, when in reality they've been to like 20 different places, but they're too embarrassed because they know they're doing wrong. And so I'll just say a little PSA, even if you're embarrassed, just be honest about it, because it's going to help our community in the end. Yeah. So, you know, yeah, you learned your lesson the hard way, but just be honest about it now so we can all move on and get over this sooner rather than later.
Exactly.
Mr. Taylor,
you have to think out of the box on this, Lindsay, which is going ahead, looking ahead, and I'm talking way in the future. They have to look at leveraging technology to help out with this, because we're still thinking in 20th century terms on how to deal with this. This is a 20th century problem, but we have 21st century technology that could actually help us with this. and then we just have to be creative in how we do that. And I'll come up with some ideas for you guys. So you all get the credit.
Thank you.
All right, Mr. Taylor had a question.
Yeah, I have a question. I noticed, I keep my little sister lives up in Albuquerque, and then I think there's some time the city had talked about or people requested. Is there any way they put out a list as far as how many infections particular business has had? I know they do that in New Mexico as far as like, I think they call it like rapid response or something like that. And basically it lists like the different businesses, the number of cases that they've had at their facility or place of business. Is there anything like that coming up in the future, or is it just too choppy and too political?
I
would, before you answer that, Lindsay, what I would recommend is that you guys take a look at that dashboard, because the public has access to it, and the dashboard really shows you like hotspots, clusters. But remember, a lot of people don't realize this, but what we consider a cluster in El Paso is 2 or more cases. A lot of people think, it's 10, 15, 20, 50, as some folks thought. But if we have a location where 2 or more people come up positive, that's considered a cluster. And that is tracked on our on the dashboard. So maybe Lindsay could get that information out to you guys in the chat, the link to it.
Absolutely. Yeah, I'll put that in the chat right now. Yeah, okay, cool. We don't do it by business. We do it by zip code, because there's some legal issues with the Texas Attorney General saying we can't say, Target on whatever has this many cases. The only way that can happen is if Target comes out and says we had this many cases. And so it's a little complicated and there's a lot of legalities in it. But like I said, or like Rep Morgan said, on the epstrong.org, and I'll put it in the chat, there's a data section, and under that you can see it's broken down by anything you can think of. They have cases by gender, cases by area code or zip code. They have cases by age. It's pretty crazy, the amount of data and how the different ways they've kind of played with it to give you, different data points. So I recommend everybody take a look at it. I know I look at it every day just to kind of see. I don't know why. I always look at the Northeast zip code, but I never look at my zip code where I live, which is weird. But Northeast is always one of the lower ones, but they're still high numbers. So,
as a matter of fact, the Northeast has the lowest amount in the entire city. Mm-hmm. Okay, so let's keep it that way, for sure.
I agree.
For sure.
Putting the link in the chat so you all can have it, but it's epstrong.org. Kim, you had your hand up.
Hey, I just wanted to let people know I had to go to my family doctor. I did not want to go, but I had to go for a medical concern last week. And I was talking to the nurse and my MD, and he said that people are putting off important health care issues because they're afraid they're afraid to go to the ER if they're having a heart attack or if they're having chest pains or mammograms or whatever. And she was telling us that the MDs are trying to, get out to tell people to still continue to get your flu shot, follow up with your doctor for your prescriptions. If something doesn't feel right, go to the doctor, and if you're having a heart attack or a stroke or any other symptoms, call 911. Because, people are putting that off, worried that there's not going to be room because of COVID. And they're trying to get the word out that you still have to take care of yourself.
Oh, yeah.
And so they were very adamant about it. But I had to go through like the TSA just to get able to see her. Everything was contactless. And they took my temperature. They asked like 8 million questions even before I got to check in. So I felt very safe. But they were telling me that a lot of women have put off preventive health care that should be done every year, and men as well, not elective surgeries or anything, but just preventative care. Even going to the dentist is really, really safe. And I speak from experience. They schedule you far between other patients, so and they are covered from head to toe, the entitled dental people. So, just remember to tell your family members if they're feeling weird or whatever, that they still need to go to the doctor. They're still going to be taken care of.
Yeah, you bring up a good point. I forgot to mention, the mayor mentioned in the press conference, like 911 is doing a lot of COVID calls, but 911 is still 911. So if you're having other issues in an emergency, please call them. They have enough units. They kind of rearrange their scheduling, so now they have kind of like a special COVID unit that works while the rest of the units are available for normal everyday 911 issues. And then as far as like hospital capacity, we are at a dangerously close, capacity of our hospitals being full, but that doesn't mean they're going to turn you away if you're having a heart attack. Yeah. So what we've done is the convention center has been set up as a COVID, hospital type thing. Oh, yeah. And so right now it has a capacity to hold 50 COVID patients, and right now it has 17 in it. So if you're being hospitalized with COVID, they're trying to transport them to the convention center to kind of alleviate the burden on the hospitals for regular emergencies and stuff like that. So that's a great point, Kim. So yeah, if you have an emergency, don't be like, oh, COVID comes first. No, call. You can still be taken care of for whatever your emergency is. And also preventative care is important too.
Very good.
Yeah.
Angela, you got anything? Hey guys, we've reached the end, but like I said, I appreciate all of you all getting out there and doing your civic duty and voting. It was wild. Yoli, you didn't miss nothing. It was rough. Okay, I don't know if you guys know, but 18 days early voting was no joke. It's no joke. But I'm glad to see El Paso got out there and did their part. Period. It looks like we're gonna have a lot of new people in judgeships, and I believe Ileana Holguin, she won over her Republican counterpart for county commissioner. Who else? But we lost some really good judges too. Okay, mm-hmm. So it's interesting how this thing is turning out. But all of you guys, I appreciate you getting out there and doing your part. And December 12th is the election date, but the runoff election date. And we'll get you guys the real number here soon, because, that isn't official, okay? But it's pretty close to right where it should be, okay? So unless anyone here knows something that we don't know. Okay, so mark December 12th on your calendar, back up about 7 days for early voting, and get out there and do your part, okay? And let's see what we're going to have. I mean, the mayoral race is very important, and so are the city council races. So only 2 city councilmen won themselves outright, and that was Cassandra Hernandez. I congratulate her for District 3. And Henry Rivera from District 7. Okay, so, kudos, and, I'm very proud of both of them. But myself, District 4 and District 2, we're in runoffs. And so is the mayor, okay? The mayor's in a runoff. So when you guys get back, you guys got another 30 days to ask all the hard questions that you want of the candidates. And then we're going to go do it. Okay, that's what we call democracy, baby. So I'm good with democracy. Okay. With that being said, Lindsay, closing prayer.
I don't have anything else, but as always, we're here every week. So please invite people to join us 5 o'clock every Thursday, except for Thanksgiving. We will not be here on Thanksgiving because of obvious reasons. So please join us every Thursday, 5 p.m. Same link every week. So we love to see you all. I won't say go vote. I feel like I was a broken record saying do your census and go vote. So I guess go vote in the runoff election. Let me modify that statement. And we'll see you all next week. Wear your mask. Don't go to parties. And be safe. Bye,
Take
y'all.
care, guys. And make sure you guys look in the chat so you can get that information for the dashboard.
Yes.
All right. Thank you.